Let's talk about Vladimir Jonda's upper cross, lower cross syndrome. He was a doctor who studied polio patients in the 50s. He also had polio and overcame it later to get post-polio syndrome. But he wanted to look at chronic pain and how that relates to what he termed upper and lower cross syndrome. So in our society, we sit a whole lot at our jobs, at the dinner table, in the cars, we're sitting often. And so that causes our bodies to go into this upper and lower cross syndrome. Again, this is something that causes chronic pain in a lot of us. And what it is some muscles, when we're in that position a lot, some muscles get what's called facilitated, and then some muscles get inhibited. So if a muscle is facilitated, it means that it's kind of on all the time, or it's really active, super actively engaged, maybe even tight. If it's inhibited, it means it's not doing its job. It's kind of taking a time out. It's kind of like not pulling its weight. It's not turned off. It just isn't working or activating like it really can or really should. So basically, we want to stretch those muscles that are facilitated or kind of turned on, and activate or get going those muscles that are inhibited or turned off. Okay, not quite turned off. So what that means basically is these muscles here, they're pretty much facilitated. So we want to do like a door jamb stretch. I'll put my arms on a door jamb like this and walk through like that and get that stretch through there. Okay. On the back side, we want to activate our shoulders, okay, or upper back. And what we want to do there is go to a wall, walk your feet forward about 6 to 8 inches, drive your elbows into the wall, and hold yourself against the wall, kind of like you would a plank, but you're just driving your elbows in the wall, your feet forward a little bit, and maintain that plank position. When it comes to activating, okay, those muscles that are inhibited, a big one would be the glute muscles, okay? So that's when you see people put a mini band around their ankles, okay? And they walk like this with that mini band around their ankles, okay? Both directions, really activating those muscles in the butt. And then also, let's activate the area that also is inhibited, okay, the stomach or core muscles, and we do that by doing planks from your elbows, from your hands, or side planks.